Last night, we uncovered a huge black market of fake, illegal, and potentially deadly weight loss jabs being sold on TikTok, Instagram, Facebook, and WhatsApp. And tonight, we can reveal another social media giant is also involved in the promotion and sale of these products: YouTube.
Source in the UK, they sorted me out with a free pen.
The most popular knockoff on the black market is one that's not even available yet: reta-tru-tide.
Weight loss was so fast, I actually had to stop my weight loss journey early and cut it short because I already hit my goal weight.
The real reta-tru-tide is being made by Eli Lilly, a pharmaceutical giant in the US, but their product hasn't yet passed clinical trials. Early trials show the real injection could be twice as potent as some of the big names already on the market. Fakes like this could be deadly, and yet the market is booming.
So at the moment, I'm seeing a lot of people use it. People, from young as teens to late 50s. For a lot of people, having the body of their dreams is a massive goal. And if they think that this can get them from A to B extremely fast with minimal amount of work, they're going to go for it and try and take it, which is a scary thing.
Richie owns a gym in Wales. He's a British and national bodybuilding champion and says the pressure can be huge. And even he admits he's considering using reta-tru-tide himself.
Yeah, I've got some ready to hand if I need to use it.
And under what circumstance would you need to use it?
If the guy to your right is using it and the guy to your left is using it, then what are you really going to do? You are probably going to start utilising it at some point.
This normalisation of unlicensed medicine exists far beyond the bodybuilding world. Gym goer Marcus heard about reta-tru-tide on social media.
It's crazy, honestly. I know it hasn't passed the clinical trials, but the hype was so much on the videos. Everyone was talking about it. If you order anything which is going to go inside your body via needle, it's quite worrying really, because you don't know what you put in your body. It could kill you. Do you mean? That's the real truth about it. But that's the chance I guess you've got to take.
And you're willing to take the risk?
And I have.
And already, some people like this YouTuber say they're getting sick.
I definitely thought I should probably hit the ER. It felt pretty scary.
Carolyn Harris is a Labour MP. She lost 8 stone after using a legitimate weight loss jab, but she's concerned about how widespread the black market already is.
It's all over social media. Does that surprise you?
I've seen it myself. It doesn't surprise me, but it horrifies me.
Is this something that you're raising in Parliament?
I'm going to be raising it. You have to educate people that you should not most definitely be taking something that comes from a source that you don't know. This is medication.
Is it really down to the people though? Is it not?
Well, no, it isn't. And it's down to us as a government. We should be looking at this. We should have anticipated this, but we didn't. Now is the time to be looking at this as an issue.
We put our findings to YouTube, but they didn't provide a statement. But TikTok told us that they've removed more content related to reta-tru-tide as a result of our investigation. It's the MHRA's job to crack down on unregulated medicines online, and they've now told us that they've launched an investigation into reta-tru-tide.
Eli Lilly, which is making the legitimate reta-tru-tide, says fakes could pose a serious risk to patients. We put our findings to 2 companies selling fake jabs claiming to be reta-tru-tide, Synedica and Alluvi. We received no response.
Reta-tru-tide.
Our reporting has revealed just how easily dangerous and illegal substances can be traded online. When it comes to protecting the public, it's clear the system is still playing catch-up.
Well, the Liberal Democrat MP, Layla Moran, is the chair of the Commons Health and Social Care Select Committee, and she joins us now from Oxford. Layla Moran, will your committee be looking into the huge black market that we've uncovered? I mean, how concerned are you?
Well, we're very concerned about this space. In fact, this week we had our first hearing in our new food and weight management inquiry. It's a massive inquiry in which we'll be looking at these weight loss jabs as a whole, and the legal and illegal markets. We feel there's a bit of a Wild West going on out there. We're very concerned about how people are using these, but also the wider system that's pushing people to use them in the first place, with 64% of people in the UK estimated to be living with obesity or being overweight. So there's a huge issue here. But I mean, particularly this illegal black market, it's as much an issue of regulation as it is about online safety.
Yeah.
And so off the back of your investigation, I've written to Liz Kendall, because this is the Culture Secretary's responsibility. The Online Safety Act should be helping regulate these social media giants. It shouldn't take a Channel 4 investigation for them to recognize that illegality is happening on their sites.
Well, yeah, the Online Safety Act obliges big tech companies to take down illegal content. I mean, the ink is barely dry on that law. It's not working, is it?
It clearly isn't yet. Liberal Democrats have been asking for a 6-month review after its implementation to see and gather all of these things. I think there might also be an issue here with it's the MHRA and the yellow card system, and they've got their own campaigns around fake meds that are meant to be regulating this. But actually, how much conversation is happening between them, Ofcom, which is the regulator that's putting the Online Safety Act into implementation, and then also these social media giants. I think this does need to be looked at in the round. It's clearly not working, and it is dangerous. I mean, this is the thing that is so clear. It's dangerous. People are taking their lives in their hands if they click on these social media sites. This quick fix that people are looking for, battling the tide of what is a wider food system failure, causing people to become overweight and obese. You know, we do need to tackle the root cause, but for now, we also need to be holding those social media giants to account, in my view.
I mean, TikTok and Meta did take down the content when we flagged it, but YouTube hadn't responded. I mean, they're not at all concerned about this stuff, are they? I mean, how do you is it until people start getting fined, they're not going to take any notice, are they?
Absolutely. I mean, the Online Safety Act, the government says, is the first step. Liberal Democrats always had concern that it didn't have enough teeth, which is why we are calling for this review. And certainly as part of our investigation, the committee's really interested in how all of this interplays. So I think Parliament is now really taking this seriously and has been for a little while already. But I'm afraid to say these weight loss jabs, I mean, reta-tru-tide is one, but there are others that are in development. These weight loss jabs, we still don't have all the evidence about their efficacy. There's new evidence that shows when you come off them, actually people put the weights back on very quickly. This is a brand new science. It could be transformational for people's lives in a very difficult space. But we also need to make sure we've got all the evidence around how they work. And if people are wanting that quick fix, I mean, if it looks too good to be true, it almost certainly is, isn't it?
Right. You've spoken publicly and movingly about your own battle with obesity, and you had stomach stapling surgery. You understand that desperation to lose weight?
I absolutely do. Goodness me, Catherine. And I still battle with it all the time. It doesn't go away. We had an evidence session this week where one of the public health officials who came in front of the committee pointed out that it's not millions of people that are having a bad day and suddenly can't keep away from the food that's bad for them. There's something wider going on in this system that we are all battling all the time. When I spoke to another researcher in our research, she said it's amazing anyone manages to keep their weight under control given the wider food system that we've got set up in this country and in other Western developed nations. So as part of our investigation and inquiry, we want to look at the food system, because it's not just enough to look at things like weight loss jabs, which are frankly treating a symptom. We want to look at the root cause. Why do we have this wider issue in this country after 2 decades worth of policies by different colours of government? We haven't got anywhere. We want to find out why.